Alannah Connealy, welcome to the podcast. One of the few names I can pronounce properly when someone comes onto the podcast. How are you? It's a pleasure to have you for our viewers. You are founder of Raena Health, and I'm delighted to have you on. So let's get into it. How are you today?
Good. How are you? Thank you for having me.
I'm pretty good for a Tuesday. Do you remember the old research back in the day? I came across this maybe 10 years ago, and there was some research done on Tuesday being the most depressive day of the week.
Really? I had
Yeah,
no
it
idea.
was
That's so
really
interesting.
interesting. On a kind of psychological level would make sense. But I wonder if there's a hormone aspect to it as well. Maybe like a serotonin estrogen aspect if you've had a load of alcohol and junk food on the weekend. It'll be
Yeah,
interesting.
yeah, that's possible.
So, you're founder of Raena Health. Would you mind telling my clients and followers the backstory of Raena, how it all
Yeah.
started, and then also what you do?
Yeah, totally. So at Raina, we do hormones, all things hormones, essential hormone solutions is what we say. So we do over-the-counter hormones that looks like progesterone cream and like natural desiccated thyroid, pregnenolone, DHA, those kind of things you can get over the counter in America. And then we also do prescriptions. So you can chat with the doctor and get a clean prescription. A lot of hormones in pharmacies are like a ton of color dyes and peanut oil and titanium dioxide. So we do all of our prescriptions a lot cleaner than the average place. So that's what we do. I started the company years ago. It's been through so many iterations though. Like every day we're iterating. It kind of started as a women's health clinic more. Like you could, meet more with doctors. We still have coaches, kind of a little bit of that, but it's not so doctor heavy. Honestly, I felt like no hate to doctors, but it did bog the company down, I think, a little bit because I had my clinical outlook of how things should be treated, and doctors have their own. And so it
Mhm.
was really hard to be consistent with how I felt we should prescribe things. And
Yeah.
so I found this is kind of a better iteration, but it takes a while for things to evolve and for you to learn those lessons. And I was really young, starting the company, and I didn't know anything. So you kind of just keep going. But I originally got interested in hormones because my mom was actually a victim of a hormone drug called DES. And,
Mm.
and it's funny because writes a lot about this drug because it was prescribed to millions and it was a synthetic estrogen. They thought it prevented miscarriage. So they were giving it to pregnant women. Turns out it caused miscarriage, but not only that, caused deformities in offspring exposed in utero, cancer, organs that were misshaped, and just so many health problems. So my mom never had two periods in a row. She was a hunchback actually from scoliosis. Like it was like her back was like hunched over. Um, and so many health issues from it. So she actually found progesterone early on. Someone was like, you have all these issues, you need to say progesterone. She credits for progesterone for literally saving her life. Like
Mm.
she was like, I can't like this is because it just wreaks havoc on your health, right? Like when your hormones are messed up. And so she actually started compounding it and making it in her office at her clinic. She's a medical doctor now. And I just became so fascinated by what she was doing that I kind of took what she was doing and wanted to scale it out, like not like give it to as many women as possible. So she's only licensed in California. I was like, why don't we, get more doctors and just expand and keep pushing it forward so people could have, cool things for their health.
Mm. So people would have options because we have
Yeah,
like different in Canada, but we have so little options compared to the States.
I know.
And then not even to talk about the education aspect, which you're amazing at.
Yeah, thank you.
Mm.
Yeah, it took years to, learn those things, and then I just now it's like you're just like breathing, right? It's like you understand the concept so deeply that you could make a ton of I don't know, it's interesting because like all health you realize is not super like every health issue isn't very unique actually. It has all the same kind of fundamental issues at it. And so it's more just like reworking it to every kind of hormonal point there is.
Well, you're correct, because it's still, no matter what your health outcomes or diagnoses, it's still the one body, and you still have the
Yeah.
same hormonal systems. I say to my clients, your hormonal system is the same as everyone else's, unless one, you have Addison's or something, or two, you turn into a sheep. then you're
Yeah.
completely different to us. But
Yeah.
otherwise, understanding the hormones are going to be pretty much the same in everyone. So it just so happens that your diagnosis might be different than the woman next. Like how it presents is different for
hmm
each of
hmm
us.
Totally. Yeah, and I've always said that it's such a big cop out to say like everyone is totally different because it's just not true. They say this for like diets and stuff, and I think we say it to like be nice, but I actually think
Or
it
a
really
sales pitch.
yeah, or a sales pitch, but it also tranquilizes you into not taking action because you think your disease is some foreign outside thing that's inflicted on you when no, 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 we all have the same basics for the most part, of course, like like what happened to my mom is kind of a crazy thing, but we all have the same cellular processes, so we can kind
Mm.
of think of it from first principles, like mechanisms and how these hormones kind of play the part in the mechanism.
Yeah, apart from some of maybe the ancestral stuff or the genetic stuff
Yeah,
maybe influences, but even as I'm sure you'll agree, the genetics is not definitive. It doesn't mean you're going to end up with that. But you're right, like, and even the diagnosis, I think once people get a diagnosis, it's almost an excuse for them then to not take action. It's, oh no, I have this. There's nothing I can do about it. There's
yeah.
loads you can do about it.
Oh yeah, yeah, yeah. Totally. Yeah, all diagnoses they usher in not only like just anxiety more than anything, but also yeah, this kind of confinement, right? It's the same thing with genetics. Like it's all confinement. When really and you become very attached to it, right? Too.
Yeah.
Yeah, I am this way. I am hypothyroid. I am, and it's like no, like bodies are very responsive, fluid, ever changing. They're literally like you have 300 million cells like dying every second. What new ones are being made? So like, there's always opportunity to change.
So Raena has a lot of products, which I
Yeah.
love, which thank you for agreeing to collaborate with me. My primary goal is to kind of educate my Canadian people, and obviously my people in America can avail of your products, but to give them options because we don't have a lot of options here. Of course, you can get stuff by prescription, but truth be known, doctors are reluctant to prescribe. So then we have to go do our own research and purchase our own stuff. So I
Yeah.
was delighted to have Carol Peterson direct me to your company, and I was like, no way.
Yeah. Yeah,
The
I love
only
Kara.
thing that we can't get to Canada is the DHEA, if I'm correct, but
Yeah.
everything else is good to go.
Yeah, I think DHA is a controlled substance. So it's a little tough on that.
It's interesting because there are some other companies that I can get DHEA from as well. So it's
Interesting.
interesting how it works.
Yeah,
But
we may be playing it safe on that. I'm not really sure.
I think that's what it was. I think
Yeah.
from speaking to one of your employees, it was more kind of play the safe game in regards there. But you have the progesterone, pregnenolone, you have desiccated thyroid, which I absolutely love.
Yeah.
That and it's 450 milligrams per capsule, so it is a good potent dose. And
hmm
then you have the blood spots. So like there's everything in the one spot that you would want.
Yeah. Yeah, we've got a lot of good products. I mean, it's not just like progesterone that goes down with aging. And so you got to address kind of all of the situations. So that's why we do have kind of the whole thing. And we kind of say like DIY your hormones. Like you figured out yourself. You only have one body and no doctor has all the information in the world. You literally have to understand at least the basics for things for you to like understand what you need to do. So that's why we have so many options. And then yeah, you can kind of do it yourself. You don't even need a doctor in a lot of these instances.
Is that some
Um,
of the products, there's like a medical intake form kind of thing? How does that work for, well, obviously people in Canada? And some people here don't
yeah.
even have doctors because they find their doctors so useless that they just don't have one
Oh
anymore. And they're
no.
like, I'm just going to do it myself.
Yeah. Well, so the prescriptions are just available in America because the doctor has to be licensed in that state and they're not licensed in Canada because it's a whole different system. But yeah, so you have to have a American address and telephone number to get it. But you basically complete the intake and then the doctor sees if you're a good candidate for the prescription. So we do oral progesterone as our number one kind of product.
Mhm.
And then he will prescribe it and it gets to your house in like 2 days. If it's pretty much as fast as anything, Amazon even. But it's progesterone. I mean, this thing could literally treat breast cancer, prevent breast cancer. So why, like women, in my opinion, I always say this, it's the most underutilized substance in the world because it can treat Alzheimer's, multiple sclerosis, like all these things, and most doctors just don't even know about it. So we're lucky to have really good people on the team that can help women at mass like get this substance. Um,
Most doctors do not know about it at all. Carol and myself were talking about this recently in a conversation and kind of discussing there was a headline in 2020 that basically said the teaching hospitals are no longer teaching about hormones or even perimenopause
yeah.
because the the summary was kind of like, because what's the point? There's nothing we can do about it. So we know doctors are not getting taught at all.
Mm.
And I think most women know this when they talk to their doctors. Like you can tell if your doctor's clueless or not. Um,
Yeah.
like to put it bluntly. Um, I back when I had a doctor, she would ask me what supplements I'm taking, and she would
Yeah.
look at me with a blank face.
Yeah.
So what's the point?
Yeah,
But,
yeah. Well, they
um,
just don't have time. Like, I mean, not to like defend them because there's absolutely no, but yeah, their life isn't filled with like the incentive to truly understand what's happening at the cellular level. And a lot of times they don't have the bandwidth to, especially with like how insurance works and stuff. And they like the standard of care, if you go outside, you might get sued, you might lose your license. So the whole system is pretty misaligned. It's very, very discouraging and disheartening, but it's never been a better time to learn about your health, really. There's never like every single repeat article is on a PDF, like his books are like, it's just like if you care about your health, you should spend the time to read about this stuff. And if you want to take any shortcuts, you're not going to get there really. And so that's why
yeah.
we educate so much. Like in the beginning, you started off, you're like, nobody produces more content than you guys. And I was like, I love to hear it because we need to help people get there.
I know, and that's my clients are like, you put out so much content, I can't keep up. I'm like, but that is the goal. That at
Yeah.
least if we direct you somewhere, some of the answers are there for you. You don't have to do as much research as we do. And back to the doctors as well. I do say to my clients, because doctors obviously have their place, and I understand their situation. And if you're a doctor, especially in Canada, there's not enough doctors to support the population in each
Mm,
city. If you
mm,
think your doctor's seeing 150 patients in a day,
yeah.
and then they have to go home and play with their kids, make their dinner, have a shower, and this is constantly their life, they don't have time to do anything else, let alone research.
Yeah,
So there's
exactly.
that aspect as well. Um, so I
Yeah,
had,
and sorry, but just to say, I see now in America too, the menopause people, there is more talk about it, but they also seem to be leading a lot with estrogen instead of what we do, which is the complete, like I had a VC investor friend ask me that. They're like, why does everyone else just talk about estrogen, but you guys talk about progesterone? And so it seems like even when there is quite a bit of education, it's not how I would teach things, really.
yeah.
So
Well,
it's just
this
kind of
is it.
interesting.
This again was another topic in my conversation with Carl recently. Like, why is there such a big push? Is there kind of a pharmaceutical influence here on the estrogen thing?
It's
Like, there's
huge.
obviously a big rabbit hole that I could go down. Why don't they want us using progesterone? But
And why are they obsessed with estrogen? It's
and
kind
then
of crazy. It's really
promoting Marie Claire, like she's being pushed into the spotlight. I had someone mention it in one of my groups earlier, like,
yeah.
well, Marie Claire says this, and I'm like, well, I don't necessarily agree what she is putting out there, but why are they pushing certain, don't want to
I mean
say
they
agendas, but the concept so
yeah.
much.
Yeah, and I think it's like there should you I guess you can push what you want to push, but I think there should also be this awareness that estrogen has risks, right? Like we should be allowed, like it's almost to the point where you're not even allowed to say that. Like it's like, no, that's against the
Oh, you're
science. And it's
crazy to say.
yeah, and I'm like, well, I mean, and this is someone like we sell estrogen actually. Like we have an interesting take on it because my mom's almost 70. And we talked at length about this, about and she was like, okay, so when you're 70 and you have a really low BMI, you basically don't have that much fat cells that
Mm.
are producing estrogen. And like you're 70 years old. And she was like, Alannah, like genuinely, if I like I know how the risk of taking estrogen, I need a little bit. So what we decided to do is do a cream with estrogen biased, that you can apply when you're older and you have a low BMI and you really are low in estrogen. And I believe Carol Peterson would agree because I've worked with Carol for a long time. And I know how she feels about estrogen. She was like, Alannah, wait till you're in your 70s. Like, and so it's kind of this time and place thing that I think is the nuance is missing from the estrogen
Mm.
conversation. But that's always been our take is like be aware of the risk of estrogen before you take it. Be
Mm.
aware of when you might actually need it, like in a scenario where you're 75 and you have 3% body fat because you can become very frail when you're older. Um, but it's not this like blanket thing that everyone needs estrogen, especially not in perimenopause when estrogen levels are known to be chaotic. So that's totally missing from the estrogen conversation. It's just like everyone gets it. You're 40 now. Now we got to blanket out this estrogen product, and it's to me kind of absurd. But
There is
everyone,
context to be considered, and they're
yeah,
not giving the context. If you have a
yeah,
200-pound woman, the chances that she needs estrogen are really slow, but she
yeah,
might need a lot more progesterone than a
yeah,
woman who's 120 pounds.
right,
So, like, we've got
yeah,
age, weight, lifestyle. Everything is a consideration, but they don't do that. And
yeah,
yesterday, I don't know how you feel about this. I would assume your opinion is the same as mine. And I didn't think this was a thing anymore, but a client said, my doctor just gave me this estrogen cream. And I was like, I always ask for pictures so I can see, because people will mispronounce stuff. So I'm like, send me a
yeah,
picture.
yeah, yeah, yeah.
And she sent me a picture of Premarin. And I immediately was
Oh
like,
wow,
oh my
that's
God,
crazy.
I didn't think they still prescribed this.
Yeah, I didn't
Like
think
I
so
was
either.
shocked. But
Yeah.
there you have it. I guess they
Yeah, I think that's pretty rare in America now to do Premarin, but I've heard it happening with very old school doctors that don't like aren't on social media or anything. They might do it, but that's pretty unheard of nowadays. So that's
Yeah, well,
crazy.
even here in Canada, I thought it had been like wiped out because I never come across it. But then
Yeah,
she sent me the picture, it was right there. I'm like, oh,
that's crazy.
yeah.
That's really weird. But yeah, I totally agree. Yeah.
So, I have a few questions for you from
Yeah.
some of my followers because I always put in one of my groups, hey, I have so and so on the podcast today. Do you have any questions for them to
Okay.
see what it is? Because sometimes for me to come up with questions, I'm almost like, I already know. You give me a question. So,
Yeah.
I've no doubt you're able to answer all these. So, the first one I
Oh.
got was, when do hormones start to change, and when is the best time or age for a woman to really start understanding her hormones and implementing some practices to support them?
Yeah. Well, I mean, hormones are changing throughout your entire life, and a lot of your hormonal profile starts really early on, unfortunately. There's some studies that show that trauma, when you're younger can actually cause an earlier menstrual cycle. Obesity when you're younger causes early menstrual cycle. So if that's the case, you may have started your menstrual cycle really young, which is a risk factor for breast cancer. And so your entire life is like all actions are imprinted on you that may change your hormonal profile. And it's really about if a hormone is like lingering, exposed for too long. And that can happen all kinds of different times. But if something is chronically unbalanced, that's kind of when we need to like get on top of it.
Mhm.
But even as young as like when you're in your 30s, I think in your early 40s, some women are only making like 25% of what they made progesterone wise than in their 20s and 30s. And so I would say like the most common age, ignoring what I just said about like, if you had trauma and stuff, you kind of need to be on top of this for as your entire life. But you have more leeway when you're younger just because everything is more capable, all
Yeah.
organs are more capable, you have less atrophy. So it's just, but usually around like when you're 39, 40. is when
Yeah.
like progesterone drops. And progesterone drops faster than estrogen. And so in my opinion, I think there's one thing you would take, it's progesterone, right? Like as early as you need it. And you can do a blood test for progesterone is actually very very accurate, which is different than like estrogen because every cell in the body can make estrogen because that's a survival like technique, right? Because you need estrogen to for your cells to divide and create new life. So it makes sense that peripheral like estrogen makes a lot of that's just part of the
Mhm. It's
existence of being
everywhere.
human. Yeah. But that's not the same for progesterone, which does make blood a really good way to understand what's going on. However, you just have to make sure you time it right. So we tell women to test on day 20 of their cycle, and progesterone's supposed to be at its highest. And if it's beneath where it's supposed to be, then you can pretty reliably, use it. And it's a very safe thing to take. There's no toxic downsides.
Mm.
It's just a really good thing. But I hope that kind of answers it.
No, it does. It does. I was thinking like when I was a baby, I was scalded, as we'd say in Ireland, so third degree burns all down
Oh
my neck. I would
no.
actually pull, like you're a little baby and I'm learning to walk, and I
Yeah.
pulled a very hot cup of tea. Of course, in Ireland it was going to be tea over myself.
Oh.
Now I don't remember, but I was in the hospital for 9 months in the children's hospital, and they thought like I wasn't going to make it. So although I don't remember it, there's obviously a lot of trauma like tagged in my central nervous system from that. And then over the years, all other kind of very stressful
Yeah.
events. And I'm like, it makes sense to me why I have no progesterone at all. And even being like a health professional and working out and geez, I sleep 9 hours a night. I prioritize everything, and still my progesterone is tanked. So
Mm.
back to that trauma thing, like it makes sense. And I've said to clients, like if your mom was pregnant with you, and even if she had a great life, but if something traumatic happened to her when she was pregnant with you, that's going to affect your
Yeah.
hormones.
Totally. Yeah, that's crazy. I mean, what a life event,
Yeah,
right?
I don't remember, but I still have the scars to remind me. But
Yeah.
it's just one of those things.
Yeah, no, it's so true. I mean, Rapey has this like these great lines about how early on trauma, like it basically stimulates the organism to like develop sooner than it should. And so it's kind of like an acorn hatching early, like a plant hatch, like a plant being created too early. And what that means is it shortens your life cycle, right? So if you the earlier you start your menstrual cycle, the earlier you start menopause, the earlier you start menopause, that's kind of the life cycle. And so you want to elongate these things as much as possible. And so this is kind of the argument for how we used to in 20 years ago, 30, 50 years ago, the age girls would get their menstrual cycle was like 16, 18. And then
Yeah.
slowly it's starting 12, 14. And now you're seeing like 12-year-olds get budding, not just menstrual cycles, but budding breasts like that, or their breasts start budding
I see
early.
12-year-olds that have bigger breasts than me.
Yeah, yeah, and that's hormonal, but that's not good because every time you ovulate, you have estrogen exposure that surged, and so you're just gonna have more ovulation exposure to estrogen for the longer you get your menstrual cycle. So,
I still
yeah,
started my cycle at 12, which when I was growing up, that was kind of average, probably the same for you. Um, and I've never had issues with my cycle, which is great.
great.
So there must have been something counterproductive there, like blocking any estrogen from trauma. But I got tagged in a Facebook post the other day, and myself and one of my friends were like, "Oh my God, that's insane." The woman had said, "My daughter, who's 8, just got her period," and like she was obviously
Wow.
panicking because you have that aspect. There's no way you've brought this up with her at 8 because you're not expecting it to happen till
Yeah,
11 or 12. And now this little girl must have got the fright of her life. Like, and then her body is so much smaller. And just
yeah.
like we were shocked. We are like, oh my
Oh
God, that's
gosh, yeah.
insane.
Yeah. Yeah, there's kind of these ancient stories of girls starting their menstrual cycle at like 25.
Hmm.
Um, so I think that's kind of cool, but yeah, it's tough as a parent. Yeah, keeping the environment as pristine as possible. Um, n Minimal stress, encouraging and challenging their environment to properly develop at the right appropriate time. Um, there's so much that goes into it. And food, I think, is a big thing. I do think unfortunately, parents are still like a lot PUFA is estrogenic, right? Like polyunsaturated fats are estrogenic. And
Mm,
so a lot of these processed foods are high, and not just like PUFA, but a combination of like, starch and PUFA and color dyes and all this kind of crappy additives and stuff. So I don't know. I'm not a parent, so I imagine it's hard, but I do think putting extra care into every detail that how you set the mine's so much because my mom did that. My mom was an insane mom, a single mom that was like obsessed with intentionally creating this environment that would create her children to thrive. And so I learned so much from how she did things, and there was intentionality with every day, with all the challenges she wanted us to have, with all the um just magic and excitement that she kind of intentionally created for us was very inspiring. And we talk a lot about parenting on her page, and I hope we do more because truly your hormone health starts with before you're even there. It's with your mom's health, your mom's hormonal profile. I mean, is kind of controversial, but a lot of childhood cancers, I believe, are connected to the mom's hormonal
yeah.
um profile. But same thing with like autism. They actually have links of high estrogen exposure and autism. And it just matters so much. Like the reason my mom has bunions is because of her estrogen exposure. It's just again, like every detail matters.
No, yeah, and there is real solid connection there between health outcomes and kids and toddlers. And I almost don't like saying it because I don't want to make moms feel guilty or that they did something wrong, but they didn't. They just didn't know.
Yes,
Yeah, like
yes,
that's where the education aspect is so important. But sometimes I am hesitant to even bring it up because I don't want to bring shame onto people for something that was almost out of
totally.
their control.
Yeah, and it totally depends on the listener, right? Because we get this a lot about cancer, like, oh, you're blaming the person, and some people seem to handle that mentally really fine. They're
Mm.
like, I did this wrong and I messed up and I should have done it differently. And some people are like, why are you blaming me?
Yeah.
And I find it hard to be responsible for everyone's responsiveness to what you say when I know in my how we say things and in our heart, we truly want people to take the information and just start today with that information and do better moving forward. You cannot undo the past. I had I've messed up so many things. I've had so many health challenges. So we have to be strong. We have to be strong with how we see the world and
Mm.
how we pick up from today. So
Yeah.
yeah,
And
I
just
agree.
be
It's tough.
better. Each day, just try to be
Yeah.
better.
Yeah.
Some people are great at taking responsibility. I think that's the word you're looking for. Some people, not so much. They don't want to play the blame game. It's someone else's fault. And I
Yeah.
get that, but no matter what area of health you're looking at, whether or not you want to get jacked or lose weight or fix your hormones, there's an element of responsibility there.
Totally. And that should be an encouraging thing, right? If you have no agency over your health, then why are we even doing anything? Why are we even eating well?
Yeah.
Like you completely absolve yourself from any sort of power when you don't think you have any responsibility for what's going on in your life. Now, like something like having my mom, like we're not blaming my mom or whatever for being exposed to that drug, or if you live next to a farm that sprays glyphosate or whatever, like that is not that those obviously not everyone is going to be responsible for everything, but for certain aspects, without a doubt, we have influence over them.
Oh, I say
So
to my teenager all the time, but it was your choice to stay up late
yeah,
and watch TV. Like, that's on
yeah,
you. And
right.
of course, he's a teenager, so he always has an excuse. Well, it's not my choice that I can't sleep. And I'm like, it totally is,
It
but
is.
he will try and twist it, and it's not.
Yeah. I have found that it's just actually way easier to take responsibility for everything. It's just do it. And then you'll see yourself how you can change and mold the world because you know that you have that power. So it's
Yeah,
actually better to just
it,
take it in stride.
it is. It's harder, but it's better. Yeah.
Yeah, exactly. Like everything in life, right?
So the next question I had was, how do hormones affect your skin?
Yeah, I mean, in so many ways, but hormones actually can produce, I mean, your skin can produce hormones. Um, I think one of the biggest things is cortisol. Like, there's like studies that the higher your cortisol levels are chronically, the more old you look. which always freaks me out, but
Yeah,
totally
I
makes sense.
know.
I'm like, oh gosh, stay calm. I don't want wrinkles.
Yeah.
I mean, it totally makes sense. I don't think this is like any crazy information. I think when you see someone too, and they have like there's sort of this franticness in their face that you can tell is from the cortisol, but that's actually not just like you percepting. It's truly like your hormones can affect the way your skin is. Um, it's interesting because I just did this post on people applying estrogen to your face.
Mm.
I don't think a lot of people realize that estrogen can harden collagen, harden it.
Mm.
And that doesn't mean collagen's bad or you shouldn't take collagen. It means that estrogen can harden it. And collagen, on your face, do you want that to be hardened? I don't know. Usually you want more of bouncy elasticity,
Mm.
rather than like a hardened matrix,
Mm.
collagen matrix. So in that way, estrogen can, on your skin actually harden things, which I think sometimes people interpret as younger looking, but I think that's pretty temporary.
Or tighter kind of thing. If it's harder, it's tighter.
Well, yeah, and estrogen, right, it is what responsible for water retention, for edema, because it draws in water to make cells divide. So that kind of plumpness might actually just be water.
Yeah.
Um,
Yeah. And then, yeah. I heard your mom say in a conversation that your skin starts from the inside. Everything that you see externally is a reflection of the inside in regards to like your acne, your eczema, dermatitis, rosacea, any
hmm
sort of idiopathic anaphylaxis. It all
Yeah,
comes from in here. It's not necessarily what you're putting on your skin.
totally. Yes, 100%. Yeah. I
And
mean, and that's what, yeah, when you go through puberty, right? Like the first thing you get is acne. What happens during puberty? All your hormones are changing.
yeah.
So,
Yeah.
no,
And
yeah.
that would explain well, I think there's a big aspect of progesterone in this when women get idiopathic anaphylaxis, which a doctor basically says that because he doesn't know why you have this rash. So we'll just call it
hmm
that. But it
hmm
usually is a big stress response. And I think progesterone could be really helpful for that. Even topical on the rash, as long as it doesn't burn you or anything, could be really
Yeah.
helpful.
Yeah, totally. I mean, yeah, progesterone has the effect of like quieting cells, right? And anytime you have a cell that's like excitatory, that's like a provoking of the cell. And it's very stressful. And so you can imagine what that does to your skin. It's not like anything is localized, right? Your hormones are moving all over, down to like your retinas, retinas have receptors, hormone receptors on them. So it's just crazy. And so yeah, it's just a mirror of what's going on inside totally your faces, without a
This is
doubt.
just a random thought, but that you mentioned retina. For a lot of people, if their body is very inflamed, the first thing to go get damaged by inflammation is their eyes. A lot of people don't know that. I wonder if you've ever considered creating a progesterone eye drop. And I think
Ooh,
I've heard Carol mention that before, that back in the day when she said they were compounding everything. And I
really?
think but like if you could get a progesterone eye drop, obviously that's going to be also closer to the brain too. That would be, and people who get TMJ, that could
Yeah,
be
yeah,
an
yeah,
interesting
yeah.
product.
We are working on a progesterone wrinkle cream, face cream, actually.
Yeah.
There's a lot of good studies that show it can prevent wrinkles. I apply our cream on my face actually right now, but we are working on a formula that's more face friendly, like, just like a little
Yeah.
bit more sensitive to the face. So we're working on that because everyone's putting estrogen on their face, and I'm like, I gotta stop
Counteract.
this.
I
I
suppose
gotta
that
stop
could be
this.
just as effective, the progesterone cream, because we have our thinnest skin around our eyes. So if you were like rubbing it in, um,
Yeah, totally. And your eye, you're right, like right under your eyes shows the aging the most. And it's hard to get rid of those fine wrinkles under here. It's so delicate. I mean, it's so miraculous, right? Like how delicate this whole everything is, but especially your eye region. It's just so important. So
Yeah,
That would be cool though, an eyedropper. I haven't thought about that.
because it would also get into the bloodstream pretty fast. Like that would imagine you could reverse macular degeneration caused by
Yeah.
inflammation with something like that. That's like
Yeah.
Nobel Prize worthy.
Yeah. Everyone's like 20/20 vision after this, like X-rays, like seeing through walls from the progesterone
Yeah, I think like
eyedropper.
everyone I know wears glasses. I don't at all, and I've no issues, but I really attribute a
Cool.
big part of that is I've been very conscious to keep my inflammation as low as
Mm,
possible. And I
mm,
was saying to my husband the other day, I'm like, everyone we know has glasses, and not just like the older people, like even young people
yeah.
our age. Even if it's just for reading or watching TV, I'm like, I wonder if we continue to be proactive, how far can we get? Like there has to have been someone who has died that never needed glasses. I
Oh,
wonder if we
totally.
could
Yeah.
get there.
Hmm.
So is that's
Yeah. Unfortunately, I have LASIK. I am not perfect here. I was blind, like nearly blind my entire life, honestly. So I got LASIK last year, and
it's
it's
great that
honestly been,
that's available though. It's
yeah.
amazing that it is available. But
Yeah.
the eyes are really interesting, especially
Yeah.
the windows to the soul and all that.
They are. They are. They are. They truly are.
So, okay, next hormone kind of goes, or question kind of goes hand in hand with the last one was how important is the liver for hormone health and balance? And I think this is a big question that most people really need to understand. So important.
Yeah, I mean the liver is so important for metabolizing out hormones, right? Like it all goes through the liver and then it's excreted. And so if your liver functions sluggish, you can't really detox out hormones or excrete them. So you can keep doing all the stuff you want, but if you can't, metabolize your hormones, then you're going to have problems. But I do think it's a hard problem to solve, right? Because, like, how do you really know if your liver is functioning well and how do you get it to be functioning well? So, I think it's really important. And I think it's something that there needs to be more. I mean, there's things you can take and stuff, but it's not like this cut and dry approach the way a lot of like treating thyroid sort of more is, I would say. And I think it's definitely not something doctors know anything about, like, when we're talking from that angle.
Mm. I think at this stage, I almost assume everybody has some liver stagnation because nutrition, lifestyle, environmental toxins, crap in our water, crap in the air. I just
Yeah.
assume, and then I always say like at least 80% of the people who come to me for help have hypothyroidism, so that's a factor. And that's not 80% of the population. That's people who come to me and they wouldn't be
Yeah,
coming to
yeah.
me if they didn't have issues.
Yeah,
So,
yeah, yeah.
but I
Yeah, I
don't
had
think people
hypothyroid.
understand.
Yeah, totally. Yeah. Yeah, everything is so important and especially the liver. I had hypothyroidism and Hashimoto's for all my life and definitely feel like I had issues there, but yeah, we try to help people and try to make sure that they can understand how to really optimize their liver function and all that.
Yeah, I have hypothyroidism as well, which I'm waiting on my desiccated thyroid to come.
Oh,
So
good.
I'm
I mean,
excited.
I hope it's getting there because the Canada strikes have been so much
That's
issue with
why
the
it's
post office.
taking so long. But I
Uh,
got a notification saying it's officially in Canada now. So I'm expecting it any day. But it's been a constant battle as well. Again, I think myself, yourself, people like us wouldn't be in health if we didn't have health issues. But I do thyroid gland and T3 and I'm great. And then like 2 months later, something will happen and I'm like, my T3 is not working anymore. I need more.
mm,
And it's
mhm.
constantly up and down. And
Yeah.
like, then I'm like, is this because I got a new bed? And I'm considering everything.
Yeah, yeah. I think especially with thyroid, it's one of those things you're like playing with. You have to play with until you get it right. Just be open, just look at it as playing, you know? Your body's changing, your dosages change, and that's kind of okay.
I just came across this is a really interesting question and something Georgie speaks about a lot, who you know of, and this just popped up. I don't know if you'll know the answer. I'm going to full circle it back to estrogen, but this person said, does increasing serotonin levels cause weight gain?
Mm, that's interesting. I'm not totally sure if it, I mean, probably because yeah, it's all, usually there's like a cascade, right? It's like always high estrogen, high cortisol, high serotonin. And so it's hard to like parse out which one is really, doing which one is causing the weight gain, whether it's like, but they're always connected, right? So it's definitely possible that through all these systems being connected, you're gaining weight and you can't lose weight.
So
But
when
estrogen, I mean, estrogen, right, it was known to like fatten up cows. And so when you're high estrogen, you get fatter and stuff. They used to give it to them but to fatten up cows, but then the cows were getting cancer and they really are incentivized to have healthy animals so that humans can eat it. So they stopped giving an estrogen, but it didn't mean that we didn't learn that cows get fat from eating estrogen. So anything that can increase estrogen and serotonin is definitely part of that story is going to cause weight gain.
But the bodybuilders back in the day, and even some now, they will inject estrogen to help them grow because it is a growing hormone. I
Yeah.
don't think a lot of people know, and I did discuss this with Georgian. High estrogen and high serotonin generally go hand in hand, but we're constantly told that high serotonin is a good thing and we want that, but we don't.
Hmm.
Like it's connected to psychosis and serial
Yeah.
killers. So
It's a
if you're
biomarker for cancer too.
yeah, if you're
So,
actively increasing serotonin, we could assume that you're increasing estrogen at the same time, and that
yeah.
estrogen is causing the weight gain because not only does estrogen cause weight gain, but it also slows down thyroid function. So now your
Hmm.
metabolism is slowing. So
Yeah.
that's how I would look at that question.
Totally, totally. Yeah, totally. Totally agree.
I'm nearly through them all. I didn't think there'd be this many. There's only like two more. She said this girl has had a lot of issues with UTIs, which I attribute a lot to estrogen and thyroid. But she says, I'd love to know if it's possible to decipher the different estrogen levels throughout our cycles. Now that I'm in perimenopause, I really don't understand how I can have low estrogen at certain times in the cycle, but still be estrogen dominant. It's confusing.
Yeah, I mean, during perimenopause, we know progesterone drops a lot and we know estrogen becomes chaotic. Actually, the best research we have is actually out of Canada on the exact chaotic nature of estrogen during perimenopause and why it does sort of become chaotic, goes up and down. And so given that it's not uncommon to be estrogen dominant even during menopause. And I've looked at so many even blood reports of women in like their 60s and their even their blood shows they're high in estrogen, which is really interesting. And so yeah, you basically you want to have a lot higher, you want to just make sure you have healthy levels of progesterone so that you're not estrogen dominant. Um, And then one thing that can happen too is like as your ovarian production of estrogen goes down, your peripheral estrogen goes up. I think it's kind of like this like your body's compensating for that ovarian. Because like, I mean, I think one of the things is like once you have a menopause, you do not have your menstrual cycle anymore. And so the ovarian production of estrogen does go down a little bit. It doesn't go to zero. Like it's not 100% zero, but it does go down. You don't have a menstrual cycle. But that doesn't mean your entire estrogen's nothing. And so that's why you can end up estrogen dominant is like peripheral estrogen picks up and aromatization picks up. That's why men get, you know, prostate cancer too, is like their aromatization is a lot stronger when
Mm.
they're older than when you're younger.
Yeah.
So that can happen in women too. And so they have more peripheral estrogen. Estrone goes up rather than estradiol. So that one estrogen, and then you're not taking progesterone and that's how you end up estrogen dominant. And then you have low thyroid, so you can't make the progesterone. So then it's not that weird to be estrogen dominant in perimenopause, but I
Yeah.
hope that
I
explains.
would add to that, and let me know if you agree, is that in regards to estrogen dominant, it is the ratio of progesterone. So most women nowadays have zero progesterone. And I know this client and her progesterone's pretty low. But I'd also
Yeah.
add, like, if it's fluctuating throughout your cycle, like we said, hormones fluctuate and it's not as easy to test estrogen in serum because estrogen does get sequestered into the tissues.
Yeah.
So that test in itself right there would almost be a write-off for me because it's not going to be accurate and you're better off looking at the symptom pictures there.
Yeah, yeah, totally. It's just the only reason you would ever do a biopsy of like tissue is if you had cancer. So no one does biopsies. I think the one surrogate is hair and nails. We
Hmm.
never did hair and nail tests because it's not the best user experience, right? It's like chop off your nail and send it to me. It's not exactly
Kind
the
of gross.
cutest.
Yeah.
Yeah. And then asking a girl to chop off her hair has never been the easiest thing. So I agree. A lot of times just going off symptoms, and you should feel good about taking progesterone. I mean, if you're going through symptoms, you can just start with progesterone really safely,
Mm.
and then go take it from there. And then go. I mean, and that is the thing. Like the Menopause Society in America does go recommend just going off symptoms, and I think there is a lot of value to that too,
Mm.
because no blood test has this like, oh, this is the answer from God, what's going on with your body. Like even thyroid tests, if you have something interrupting the usage of the thyroid hormones to the cell, that can be a little bit,
Mm.
you might be misinterpreting. You might say, "Oh, my thyroid's normal," but actually I have all these thyroid symptoms. Why is that?
Yeah.
Um, so yeah,
Yeah.
it's common.
Yeah. And she said, like, how I can have low estrogen in perimenopause. I don't actually think she has low estrogen. I think it is the fluctuations at the time of the test, but also, again, it's not a great tool to test estrogen in blood. So
Yeah, exactly.
I think you're almost getting a false result there.
It's really possible. Yeah. It's really possible. We
Um,
we tell a lot of people if you're in your 40s just to start with progesterone. It's called progesterone monotherapy is what we call it.
yeah.
But you don't there's like there I don't know, I kind of think there's the idea that if you take progesterone, you have to take estrogen, which couldn't be farther from the truth. If that was me, I would just start with progesterone and see how my symptoms subside and go from there.
Prolactin. Doesn't your blood test prolactin? Well,
No.
prolactin seems to be a better marker for high estrogen anyway. And
Yeah.
I've noticed that when my clients ask for that, they do get it tested. So I think that's more reliable. High prolactin
Yeah.
is going to tell you you have high estrogen.
Yeah, prolactin's a great marker. A lot of women come to us with it high, which I think is a testament of how much stress women are under, because it's a stress hormone and it
Mhm.
can, yeah, wreak a lot of havoc. So, but yeah, usually it's can measure, it can, make sure, see it like kind of as a biomarker for estrogen storage too. And you can use that as well.
So
It's a
I
good
have
thing to
two
know.
questions left, if that's good with you.
Yeah, yeah,
Okay.
totally.
And this one, I think we've already answered it, but I know this client is listening, so I want to like let her
Okay.
hear. So she asked, how would you address estrogen dominance with the symptoms being issues losing weight, chronic debilitating migraines, very heavy bleeds, menstrual
Mhm.
pain, high adrenaline, and swollen and thick breast tissue? So obviously like a really severe case of estrogen dominance there.
Yeah, I mean, I think foundationally that has to be right no matter what. Like, no amount of hormones is a panacea for anything, and you have to nail the foundation. So, we provide a lot of education on how to eat pro-metabolic, like how to eat well, and really renovate how you're eating first and foremost. A lot of women are not eating enough protein, and without like protein, you're not going to be able to, your liver's not going to work right, all that stuff's connected. So I think without a doubt, like no leeway on how you're eating. Like if you're eating a lot of PUFA, that's going to be estrogenic. You have to keep PUFA pretty low, honestly. Like it should be a very low amount of your calories as polyunsaturated fats if this is what's going on. And then I think secondly is getting as much sunlight and red light as you can. Like that is this the easiest way to change your health is just to get more sunlight, which I'm guilty of not getting enough sun, but I'm working on changing that. So I'm right there with this person. But you have to environmentally like change your entire, like surroundings and everything. So I think that's number two. And then third and fourth are making sure you have enough thyroid levels because you need thyroid to make progesterone. And so I think a lot of times they just go hand in hand. And so starting out with like a low dose of thyroid if you need it, if you have those symptoms like cold hands, cold feet, it sounds like you are gaining weight and stuff. So I think, like I was really chubby when I didn't have thyroid. It was crazy. Like my metabolism was so slow.
Mhm.
I felt like I felt like I could never reach my true weight, no matter how while I was eating. I went on thyroid within 2 weeks. I lost like 15 pounds. It was insane. And I never went off of it. I was like, okay, I'm not gonna mess around here. I'm gonna stay with thyroid. And then the last thing is progesterone, which is the most direct anti-estrogen, right? Like you can also take pregnenolone as well. I don't know how old she is, but she's like 40. She could start taking pregnenolone too, which is also an estrogen antagonist. So two estrogen antagonists, and literally what progesterone does is it causes the estrogen receptor to decompose, where it's then excreted out the body. And so those direct anti-estrogens are going to be really important, and that's different than like taking Vitex, right? I see so many women that are like, "Oh, I take Vitex to boost progesterone." Like, you can't mess around with these kind of situations, okay? You have to go directly to the problem. You can't be like, "Oh, I think this herb might work." No, you need to like actually pay attention to the mechanisms because progesterone is a direct anti-estrogen. You don't know what the other side effects of like Vitex is going to be. So you don't want to kind of confuse too many systems, I think. So yeah, I would do all of that and then apply the progesterone to your breast. One thing when you start taking progesterone is something called estrogen kickback, which increase the estrogen in your blood. So you got to give this some time. I would definitely say like have mercy on yourself. Patience and mercy on these things because the longer your hormones have been messed up, like don't expect an overnight magic bullet, right? These things take years to, I mean, they took years to build up and you ended up here. Like it's going to take time to resolve. So
Mhm.
start now though. And so make all these changes that I've just said. I think just keeping stress as minimal as possible as well. Like I frequently say with cancer treatment, like because my mom, treats cancer, like no amount of the best treatments in the world can overcome a stressful person. And
Mhm.
I've seen it. I've seen it firsthand. Like there was this one patient that she actually got a clear scan, and then she found out her husband was cheating on her with a friend, and like within days relapsed, and she passed away. Um,
Yeah, it's
and
shocking.
it's just crazy. So it's like you just unless if your body is in this stress state, not only is it stress, when you're in a stress state, you're welcoming more stress. And we see this with customers too. Like the kind of the craziest, meanest customers always have the most chaotic things happen to them. And then it's the opposite where they are in their peace. And so I think weight and who you are is so much also a mental game, mental component. So you need to do all of those like strategic biohacking things, but you got to get right in here first.
Stress is a huge factor. I've always said if anything's going to take me out, it's going to be stress. Like, I still think as much as we talk about it, it's still under-recognized.
I know. And some people now are like, oh, everything's blaming cortisol. And it's like, well, actually, that can literally like catabolize your bones. Like it literally causes, your bones to disintegrate. So we probably under talk about cortisol.
Yeah.
Um,
Well,
so
maybe we need to educate louder because you're stressed, you're not going to sleep. Right there, we've got a problem. But with this, with the pregnenolone, would you dose that at night to optimize the sleep and then just do multiple doses of the progesterone then earlier in the day, especially if she was in like that PMS phase where she's having the migraine and starting to get the cramps and stuff?
you can pregnenolone you usually take in the morning. Actually, we dose it at 30 milligrams a day. You don't need to go higher than that because you want to match what you naturally make in a day. So you can take that in the morning. Progesterone usually is at night, so because for the sleep benefits. And if you've taken too much progesterone, you'll know because you'll feel drowsy the next day. You can split up the doses. I apply my progesterone in the morning actually, but I'm just kind of like I'm just kind of chill. Like I'm like, I don't know, I'm not 45 years old, right? So it's not like I'm not being so strategic, but yeah, if that was me, I would probably be a little bit more careful just to dial things in, if I was getting the headaches. And yeah, a lot of women have headaches, premenstrually, because of, higher estrogen and then it can have an effect on the nerves in your brain. And so a lot of women get those migraines. I know that's why also a lot of women self-medicate with coffee for the migraines, which I had someone comment on a video the other day. They're like, coffee is the only thing that gets rid of my menstrual migraine. Well, caffeine can increase progesterone. So they're kind of like instinctually medicating, which is really cool, I think, of women. Women are kind of, like witches in that sense. We're like self-medicating all these things. So yeah, I would do all those things, but you don't have to take it at night or anything. It's usually actually in the
I
morning.
was wondering if DHEA would be beneficial in this context. Mm.
Totally. I mean, DHEA is another thing you can pretty easily measure in the blood as well. And like in America, there's no cheaper hormone than DHEA. It's pretty crazy why like it's a controlled substance in other places because it's abundant here, right? It's like
Mm.
the cheapest hormone there is. And it's just so straightforward to fix. If you have low DHEA, fix it. Take DHEA. There's it's like sense to change how your brain works. If you have low DHEA, you're a higher risk of getting depression and so many mental health issues. And I actually had a patient contacted us that was like, I feel something my brain turned on when I started taking 5 milligrams a day. You do not need higher than 10 milligrams, never go above 10 milligrams really, because it can aromatize.
Mhm.
So just take, 5 or 10 milligrams like what we have. But yeah, she might need that depending on her age. You can kind of go off age too. If she's like 40, you're probably gonna need DHEA. It just goes down so
I
much.
believe
But the
she's
good news is it's
46, if I'm correct. And she also does night shifts. So then I
oh
was
my
like,
gosh.
oh, I think
Oh my gosh.
HCA might be an option.
Oh my gosh. Yeah, it's such a struggle with people night shifts. It's really hard. I remember my mom used to recommend they get a new job, literally.
I've said
Because
it to people.
yeah.
And I feel bad, but like I say my night shift clients are my hardest clients, not in a sense that they're hard, they're my loveliest clients.
Oh
But
yeah.
to see results, to get results, they're the hardest people to get results in.
Yeah. Yeah, it's really hard. The light dysfunction and everything. Well, I mean, everything. The sleep and everything. So my heart goes out to her,
I
really.
think there's a bit of delusion there that, they think, well, I'm still getting my sleep during the day, so my circadian and hormonal rhythm shouldn't be messed up. I'm just kind of flipping my day. But it
Mm,
doesn't work like
doesn't
that.
work like that.
If
No,
only it did, it would be great, but it doesn't work like that. So
it doesn't. Yeah, I mean, I think there's that great line that's like, sleep is a shield against stress because darkness is very stressful. And you can't, it's very hard to outsmart the universe that has
yeah.
led here. And so we can try, but it's going to be hard. I mean, I think that yeah, darkness is very stressful. Tumors grow more in darkness, not to scare anyone, but they like
I know.
that's why you do want to sleep all the way through darkness, so that you're not getting. And then when I wake up in the middle of the night, I can like feel the adrenaline pumping because people don't realize too, it's not just cortisol. Adrenaline always pumps before cortisol, always.
This
Okay,
is what
like
I say, and nobody says it. Because Dr.
oh
Pat,
yeah.
of course, taught me
Oh,
that from
really?
day
Oh, really?
one.
Yeah, it's
I'm like,
funny.
stop everyone talking about cortisol so much. It's adrenaline. Like, the way I put it is if a dinosaur came in behind me now, it's adrenaline that's getting me out the back
Yeah, yeah, yeah.
door.
Yeah, it's actually adrenaline. Yeah, I know. I feel like I hope I talk about it a lot because people don't realize that adrenaline shoots off before cortisol, but so it's just as much as a problem, and they can both cause cancer, adrenaline and cortisol exposure, like chronic, both of those because they're stress hormones, right? And I just think in the modern age, for whatever reason, we're getting a lot more of those two hormones,
This was a
unfortunately.
big factor in the nurses' study as well, was the changes in these hormones with these nurses doing night shifts too.
Yeah, it's
So we could
brutal.
try our best to counteract it, but nature is smarter than us, and we'll only get so far, I think.
Yeah, no, I totally agree. But it sounds like she's doing what she can, and that's awesome. Yeah.
Last question. This is a bit of a misnomer, so hopefully you might be able to. This is more on thyroid, and this
Okay.
was a new one for me. So this client was like, "Oh, I'm thinking of ordering Raina's desiccated thyroid," and I'm like, "Okay," but I already knew this client was on Synthroid and T3, so I'm like, "Okay," but I'd just like to understand the context. Like, why do you want to order it if you're already taking Synthroid and
Yep.
T3?
Yep.
Um, so she was explaining like the T3 does nothing for her as it does for
Mm,
most people, but or the T4 does nothing for her as it does for most people. Um, and the question really was, do you think it would be okay to add in desiccated thyroid with Synthroid and a separate T3? So I mean, I take T3 and thyroid glands, and once I get
Yeah.
the desiccated thyroid, I'm still deciding which one will I stop. Well, I might just stop everything and see what the desiccated thyroid does for me. But for
Yeah.
her, I was a bit apprehensive
Yeah.
because um,
Yeah,
she
you
also
definitely don't
had.
want to push it too much. You don't want too much thyroid hormones, right? You'll send yourself into hyperthyroidism. So your first signal is your heart starts beating really fast. So you don't want to go overboard on the thyroid meds, you know. I think on our page we tell people it's not to be taken with other thyroid meds, just because you just want to be cautious and careful. Don't want to overdo it, really.
But
Push it
this
too
is
much.
such this case is so unusual because I agree with what you're saying, but she was telling me. And it was only because I encouraged her a couple of months ago to get her doctor to put her on T3, and thankfully he did. Like, that's a
That's
miracle in
cool.
itself.
Yeah, that's crazy.
But
Yeah.
she has to stay on Synthroid, but Synthroid makes her hair fall out. And so immediately I'm like, well, normally we see hair loss when you need thyroid, but
Yeah.
your hair is falling out now when you're taking thyroid. So this is a very confusing case for me because normally I would say what you said,
Yeah.
well, let's stop either the T4 or T3 and try one capsule of desiccated thyroid, see what happens. But now it seems like she somehow cannot stop Synthroid. Like she needs it, but the Synthroid also makes her hair fall out, and that's why she was hoping she could transition to desiccated.
Interesting. Interesting. Yeah, that's a really toughie. Yeah. Usually I mean, it's hard, right? I think I mean, she could I think yeah, she's just got to keep playing around
I
to see
also
what
believe
dose
she's
makes her feel good.
estrogen dominant as well. She's had a double mastectomy because her mom had breast cancer. So she precautionary had a double mastectomy and now she's getting her nipples removed as well.
Ow.
So
Oh
now I'm
my.
starting to think
Oh, well, I
maybe
mean,
thyroid's not the way. Maybe
I mean,
progesterone is the way.
well, first of all, like if you get surgery, your hair can fall out because of the stress you're putting yourself under. Not only the stress, but like anesthesia and all of these really invasive, really invasive methods they use when they put anyone under surgery. So I don't know if maybe we're blaming thyroid for something that stress is causing.
Hmm.
Um, and maybe it's just innocent, but I don't know, right? She's her life and she's got her own kind of experiences. So, but just something to consider. I know those surgeries are so injurious. And so the comeback period for those is like could be 6 months, you know, or a year from removing your entire breast and stuff. So there's nothing right, there's nothing localized. If you have an injury to your body, the whole body reacts.
Hmm.
It's not just like the area around it, unfortunately.
Yeah.
So I think giving it some time after that for sure, and then kind of going through that and figuring it out. But yeah, playing with the thyroids. Yeah, I think I like the natural desiccated. It has the whole spectrum of thyroids. It's got two T0, T1, T2, kind of the lesser talked thyroids. And I think, you know, it coming from the earth does resemble the human thyroid a lot,
Mhm.
but I also know people that like just T3. It is hard to get. It's really hard to get pure T3. So even doctors here, I've never even really gotten it. I could order from Mexico. It's kind of a hassle, and I feel fine on the natural desiccated thyroid. So we are coming out with multiple doses in the next like month. So we'll have people have some more options. We'll have some lower doses as well, in case people want to kind of do a little bit more mix and matching, like you just said. So hopefully we can resolve some of these hindrances.
Yeah. I think maybe
Yeah.
desiccated thyroid, but also I think she's a good candidate for the progesterone because estrogen dominance is clear in her family.
Yeah, and it can help with some of the healing, like, you know, if prolactin's high, it opposes prolactin and it opposes cortisol. So
Mm.
I think making sure progesterone's really good. I mean, they even say they have the best outcomes for like cancer surgeries when a woman does it during her luteal phase when progesterone's high and protecting you.
Yeah.
So, which is
Well,
crazy.
we got through a lot. We actually
Yes.
got through a lot. So thank you for your time. This has been, I think everyone's going to find this awesome. Um, a lot of
Oh
kind of
my
off the
gosh.
cuff questions there. So thank you for answering them.
I hope so. No problem. I'm happy to answer whatever.
This has been great, and I love that your company now is an option for my clients. And
Yeah,
that
totally.
is like we're kind of on the same mission, educate, help, provide
Yeah,
options. Like that is it. Where we're
totally.
instead of looking for that needle in the haystack and feeling like there's no hope, like nobody will help me. There's always hope.
Totally, totally. Yeah, I gotta get you like a discount code for your clients. I didn't know
I
this.
already
This is
have one.
Oh, you're on
Um,
top of it. You're on
Yeah,
top.
Venice, I think her name is.
Yeah,
Yep. She set
yep,
me up with one. So
she's
that's
my
up on
girl.
my website. So if I'm
Ah,
correct, it's just Find Health. That's all it is. So nice and
okay,
easy for people. So yeah.
amazing. Super cool.
Well, where can everyone find you? I mean, I'm going to tell them, but you might as well while you're here.
Well, we're on Raena.com, Raena.com. Super easy domain. I'm on Twitter and Instagram, usually posting about cancer and hormones and everything. And our Instagram, is really active. So we do Q&As. I need to find a little bit more time. Every time I get to do a Q&A, I get overwhelmed. I'm like, never mind. So I need to maybe do more like YouTube lives or something like that, or Instagram lives where it's not so much like spending 30 minutes to do an
Or get
answer.
someone to help you with Q&As as well. But
Yeah, I should do that too. They're so hard. The questions come in and I'm like, oh my God, there's so many of these. How do people do these? I'm like, there's got to be a better
I
way.
usually, when I do it, I say I'll answer as many as I can within this time frame. So they know
Okay.
like I may not get to their question.
Okay, okay, okay.
But
Good,
I
good.
love your Instagram, like
Thank
so
you.
much. And also for our listeners, when you go on to Raena.com, they have a chance to win a $200 gift card as well. So make sure you fill
Yeah.
that in.
Yeah, yeah. Thank you. We have to announce the winner, I think, in the next like
That's
this month. So
right.
But anyway, thank you. Thank you so much for having me. Yeah.
Well, thank you for your time today, and we will chat soon.
All right.